Hi, this is Dr. Dallin Robinson with Robinson Natural Health Solutions right here in Slidell, Louisiana. You're probably watching this video because you or somebody you know has fibromyalgia, has been diagnosed, or maybe have not been diagnosed and you're having a lot of the symptoms of fibromyalgia. Well, I would like to talk about, just briefly in this video, about what makes us different and some of the things that we're doing that get results with people with fibromyalgia. First of all, we test and treat people from a metabolic standpoint, a neurologic, and a structural standpoint. When we're talking about metabolic, we're talking about the things that happen from the time you eat food until it's produced as energy. When we're talking about neurologic, we're talking about the brain and the nervous system, and if that's not working right, yeah, you got problems. From a structural standpoint, if a person has a structural problem, frequently it causes pain. And enough pain, it's almost like it pulls the energy right out of you. In this office, we look at a person from these three standpoints, and by doing that, we leave no stone unturned to find out the cause and treat that person. In this country, it's estimated that there are 4 million people that have been diagnosed with fibromyalgia. Well, in this office, we see a lot of people who have not been diagnosed but have all the symptoms or related symptoms of fibromyalgia. And that's the reason we look at a person from a metabolic, neurologic, and structural standpoint. First thing we look at specific metabolic testing and treatment. And at the top of the list is energy production. Most people that come in, fatigue in this country is pervasive, and it's been for almost 100 years. We look at energy production. What happens from a time a person eats food until it's produced as energy? In other words, ATP, adenosine triphosphate, is what the cells themselves use for energy. When you're converting carbohydrates, for instance, from glucose to energy, you go through two phases. One is an aerobic, in other words, without oxygen, and the other is with oxygen, which occurs in the mitochondria, those little powerhouse of the cells. If the only thing you're able to go through is the anaerobic phase, then you end up with about 1/4 the energy that you would get if you went through the whole phase. With the end of the anaerobic phase, a lot of times lactic acid is produced, acetaldehyde is produced, ethanol is produced. Those chemicals will produce, some of them will make you feel like you have a hangover. Lactic acid will make your muscles ache and be sore to touch. Some of those chemicals will cause dilation of blood vessels. When the blood vessels dilate, you don't get circulation into the air the way you should. Then you get a loss of nutrition and oxygen into the tissues, and that just perpetuates the problem. Another thing that we like to do here is we like to do sensitivity testing. Find out if a person is sensitive to some of the foods that they eat, or maybe the chemicals that they're coming into contact with. The big three are gluten, dairy, and soy, but we also find people are sensitive to other things. In some cases, things like potatoes. Some people, rice. Some people, quinoa, peanuts, different nuts. Sometimes the chemicals that are put in foods as preservatives. Big one, BHA, polysorbate 80, polysorbate 60, those things. Some people eat them, they get reactions. They may get aches and pains, certain parts of the body. They may get swelling in the ears, headaches, variety of symptoms that people get from these food or chemical sensitivities. Another thing that we like to do is we like to look at the person's blood panels, maybe the thyroid, complete metabolic profile, look at the lipids. We look at it from a functional standpoint. There are lab ranges, and a lot of people come in and they say, well, all my labs are normal. Well, we take that and we look at it from a functional standpoint. There are functional ranges that are established by things like Functional Medicine University, a lot of the nutrition companies that do a lot of research. Functional ranges better reflect a real healthy person. We like to look at it from functional ranges to find out if a person may have inflammation, maybe they have anemia where they're not able to transport enough oxygen into the cells to produce energy. Maybe the person has a liver problem, a gastrointestinal problem, maybe blood sugar, maybe they have an autoimmune problem. We need to know that to adequately treat those people from a metabolic standpoint. We like to look at a lot of times the adrenal stress index, which is a saliva test, a lot like taking a DNA test. Tells us how well the adrenals or the stress glands are working. A lot of fatigue is related to adrenal fatigue. And there are a lot of books out there written about adrenal fatigue. We like to know if a person's gastrointestinal system is working as it should. There's something called leaky gut syndrome, which means the intestines are more permeable than they should. And bits of food that have not been fully digested may be getting in the bloodstream. Bacteria may be getting in the bloodstream. Well, that triggers an immune response. And that long-term immune response can create inflammation, can create an autoimmune problem. We like to look at a person from a neurologic standpoint and a structural standpoint. If the brain and the nervous system are not doing as well as you should, a person may have brain fog, may have memory problems. That can contribute to aches and pains. A lot of problems people think are diseases of aging are neurologic and metabolic problems. We like to look at a person from a structural standpoint, which is what chiropractors have been doing for 100 years. If a person has a structural problem, then they have aches and pains that it's almost like it sucks the energy out of the body. When a person has a neurologic or a structural problem, we'll do chiropractic. We'll do that regular chiropractic, but we'll also give them neurological exercises to help stimulate that part of the brain or the nervous system that we find functioning at a lower rate. That can be vibration, that can be dot maze, that can be oxygen therapy, might be eye lights to stimulate a certain part of the brain, exercising with a metronome, a lot of different things that stimulate different parts of the body, different parts of the nervous system. Those are the things, testing and treatment, that we frequently do. If you would like to learn more about this, fill out the form and request a DVD, or come by our office and ask for one. The question I'd like for you to ask yourself is, how has fibromyalgia affected yourself, your family, your friends, relationships? Along with fibromyalgia, fatigue, a lot of times anxiety and emotional problems are there. How does that affect your family? How hard is it to deal with somebody with emotional issues, anxiety issues, fatigue all the time? How has this problem affected you as far as time, money, sleep, and happiness? And another thing that you should do is picture yourself in 1 to 5 years. If you don't get an answer to this problem, what are you going to be like in 1 to 5 years? Ask yourself, what is it worth to improve this condition? Again, if you want to know more, fill out the form to request a DVD. Right here on this video, it may be the first step to becoming pain-free and getting your life back. So lastly, Dr. Dallin Robinson, right here in Slidell, Louisiana, Robinson Natural Health Solutions. Fill out the form, request a DVD, or call our office. That would be a good thing to do. Call our office. Tell us you're tired of hurting. You want to see what it takes to get over the problem. Thanks for watching this video, and I look forward to helping you.